Hi, everyone. Welcome to Coping with COVID-19 for people over age 60. I'm Alison Christopher, the social worker at the Westford Council on Aging, and today I'm pleased to have the opportunity to interview Dr. Rachel Movitz. Dr. Movitz is a licensed psychologist and specialist in geropsychology and geriatric neuropsychology with a private practice in Westford. She received her doctorate in psychology from William James College in 2003, and she's been specializing in work with older adults throughout her career. She's especially interested in supporting older adults during significant life stressors and transitions. And since we both have a strong interest in helping older adults, we thought this would be an interesting conversation for us and for all of you. Dr. Movitz, thanks so much for being here today to talk about the effects of the COVID-19 pandemic on older adults and their mental health. To start, could you tell us about how a stressor like this pandemic might impact the mental health of older adults and what specific signs to watch for that might suggest to an older adult or to their family member that there may be changes in mental health that need attention?
Yes, thank you so much for having me, Alison. I'm happy to be here today and to talk about such an important topic. So if we think about mental health in the general population, prior to the pandemic, the approximate percentage of people who have been experiencing depression is about 5 to 7%. And that thought to have gone up significantly as a result of this pandemic, possibly up to closer to 30%. So if we're thinking about a jump that high, we definitely have to be concerned that this is occurring in the older adult population as well, particularly since the percentage of older adults who experience depression is higher at the baseline prior to the pandemic, and that was 20% of individuals and older had been experiencing some type of mental health concern. So that could be depression, anxiety, or substance use disorder, or both. So that's 1 in 5 individuals that are experiencing depression or substance abuse, anxiety. So we definitely have to be thinking about that as a significant risk factor that the pandemic is only exacerbating those issues. And when we think about depression alone, 2 million in America that have experienced depression alone prior to the pandemic. So of course we would think that that percentage could be higher, or that amount could be higher as well. So the most common mental health issues that older adults experience include anxiety and depression, as well as cognitive impairment. And some of the signs that we want to watch for that indicate that an experience of mood issues is more significant than mood is that they appear to have an ongoing difficulty with the symptoms that I'm going to describe. So that could include sadness with or without crying spells, loss of interest or pleasure in normal activities, visiting with friends and families members, loss of appetite or increase in appetite that is resulting in changes to weight, either weight loss or weight gain over a short period of time, speech or reactions or movements, difficulty with sleep, that could be trouble falling asleep, staying asleep, or early morning awakening, difficulty with concentrating, feeling worthless or guilty, and having frequent thoughts of death, dying, or suicide. And as I mentioned, it's more than a passing mood. In fact, you need to be experiencing 4 or more of these symptoms every day for approximately 2 weeks or more in order to be diagnosed with depression. Anxiety would be described as a state of constant worry, and often people who suffer from anxiety feel as though it's unrelenting, that it's never going to end, and that they have difficulty controlling it. And it does have a significant impact on their daily functioning. And we have seen a spike in anxiety pandemic and resulting in a lot of significant difficulties with people meeting their basic needs. And I see this with a lot of my clients who are older adults, that because they are considered higher risk for this virus, they are experiencing a significant increase in anxiety as well. And the unfortunate thing is that depression can be mistaken for medical issues or medication side effects. And so it can be masked or difficult to identify. And so this could make for, as I mentioned, difficulty with identifying it, and of course getting the treatment that would be most helpful when it is being experienced. So the red flags that we really want to be looking for that would tell us that the depression is present rather than a medication side effect or a medical problem would be loss of pleasure, to be less interested in seeing their friends and family members, or they don't like the hobbies that they had previously been engaged in. They're expressing feelings of worthlessness or guilt, or they are expressing a wish to die. And in particular, if someone is expressing a wish to die, we shouldn't look at that as, oh, the person is older and they probably just, they've gotten to that point where they don't really have much purpose. Die is not a common experience of normal aging and should be seen as a significant red flag that may even require acute interventions such as hospitalization.
Of course, that makes sense. So after hearing some of the symptoms, are there particular older adults who might be more vulnerable to these things?
Definitely have certain populations that would be considered more vulnerable. And in particular, if individuals have been diagnosed with major depression or possibly a milder form of depression known as dysthymia, those types of disorders could be associated with the increased risk for sadness and fear and what we might call a double depression, where people perturbations of their pre-existing conditions. In addition, if people have pain or discomfort, that can often cause anxiety at someone's baseline. So we can only imagine if they've lost the ability to walk or to exercise or to have the PT that perhaps they need to reduce pain, that will increase anxiety and in many cases depression as well. Basic needs due to increased risk for exposure, that could certainly make them more vulnerable to depression or anxiety. And of course, this is a higher risk population, older adults. So this is not uncommon for people to be experiencing more anxiety and depression as a result of feeling so concerned about their health and safety and the potential risk. And we have to be thinking about people who have had exposure. This is a situation that is unprecedented. We're in our homes, we're isolated. And so if you can imagine someone who's been through some type of trauma where they were perhaps confined in a small space, or they saw a lot of people dying, this is probably in many ways echoing that experience. And so we need to be thinking about those experiences and how that might bring increased those who have traumatic experiences. And seniors with memory problems or other cognitive deficits may not be coping as well as they would have at their baseline because they have lost some of the capacity to access prior coping skills that they may have utilized earlier in life. So I think we have to be particularly vigilant about watching for increased symptoms in those populations. And our caregivers too, we need to think about the fact that many are older adults. They are experiencing increased caregiver stress, and that is the result of taking on new roles or duties that perhaps had been held by others. They don't have the VNA services or the other supports that had been coming into the home because those services are not available during the pandemic or have not been available during some parts of this pandemic. And without the ability to get the supports, risk for increased caregiver burnout. There's no respite for caregivers. They don't have the opportunity to fill their cup. So they're burned out and exhausted. They don't have the opportunity to send their loved one perhaps to a day program or to have companions come in so that they can get breaks. And so these are some factors that might increase risk among these vulnerable.
Absolutely. What about other pre-COVID stressors or issues that someone might have that could impact the risk for mental health issues among this population?
So we want to think about underlying health conditions and the fact that if someone does have multiple medical comorbidities or certain medications that they're on, such as that might increase their risk for the virus or serious complications. And so individuals in those categories may have much more anxiety or depression and really feel even more isolated than some older adults without these particular underlying conditions, who may feel a little more comfortable getting out or even having socially distant visits. Some of my clients who have more risk factors have been completely isolated and felt safe to take a walk. And so we really need to think about that as a significant factor. Chronic pain and worsening medical problems due to these conditions, as well as and the inability to get the treatment that they need for the conditions or the therapies, as I mentioned, as well as individuals with dementia who may experience a decline in support mentioned, and so we might see more impairment in their ability to function independently and to problem solve how they can get their needs met. And they may have increased risk for self-neglect, and it could result in forgetting to take medications that they are using for depression or anxiety treatment, as well as possible increases in alcohol or substance use that might increase confusion or other mood symptoms. And the other things we have to think about among this population are socioeconomic issues associated with retirement, and many people being on a fixed income and being very concerned about, what am I going to do if I am hospitalized or if I have medical conditions that need to be treated, that in the context of getting this virus and perhaps recovering, but having significant medical conditions, worry about the hospitalization. Some people are not going to the hospital when they're experiencing other issues at this point, such as strokes and heart attacks. We've heard about this in the news, how people are delaying care. So for these other issues, so those definitely complicate this situation. And strokes can increase risk for depression. So if someone isn't getting attention for that, then that can be a long-term outcome as well. Someone is worried about getting food, paying for their bills and medications. These are certainly significant issues that we need to be thinking about related to socioeconomic and demographic variables.
So older adults already are at higher risk for anxiety and depression than the general population. What are some of the other societal issues that might impact older adults more severely or disproportionately now during this crisis?
Well, I want to start by saying that anxiety and depression are not a normal part of aging, but depression is underdiagnosed approximately 50% of the time. So there are reasons for this, and I think it's really important to consider what those are. And we start with ageism. I think too often depression, and we hear some well-intentioned family members or doctors saying, "Oh, well, if I had these types of medical problems, or if I had cognitive impairment, I'd be depressed too." And I think that the minimization or normalization of these issues is certainly a problem, a systemic issue. So we want to think about how to educate members, and our providers are certainly at this point being more educated about mood issues that they need to be on the lookout for. Fatigue and reduced appetite and changes in sleep may be considered normal among older adults. However, and they may actually be attributed to a medication side effect or medical conditions. However, that's often not the case, and these symptoms could, as I mentioned, be the result of depression or mood issues. It is difficult but very necessary to differentiate depression and anxiety from dementia. So concentration, motivation issues, and processing speed can be affected by depression and anxiety, and these can overlap with medical conditions and sometimes even be mistaken for dementia, which we call a pseudo-dementia, where someone appears to have, but really what we're seeing is mood symptoms. And if they have a test battery administered, neuropsychological testing, that might help to uncover the fact that it really is more of a mood issue that's occurring rather than a cognitive disorder. There are mental health system barriers, of course, that can interfere with the identification and so there are, unfortunately, a lack of specialists in the mental health care for older adults. The current population of geriatric psychiatrists is not sufficient to treat people, and that is an ongoing issue. And the amount of time, the wait time for people to get appointments is very long, from what I hear from my clients and in the news, of course. So the lack of access is a problem, and many older adults still feel stigma associated with mental health issues and seeking care. And so this is a problem. If people feel like this somehow means there's something wrong with them, and that it's a character flaw, then they're not likely to get the help that they need. And so we really need to help older adults understand that there is nothing that they've done wrong, or nothing that characterological, that this is a difficult time, that many individuals among the general population are experiencing depression and anxiety for the first time. So of course, it wouldn't be surprising that older adults who are at higher risk for the virus and are needing to isolate more would be maybe even at more risk for depression and anxiety, mental health issues, substance abuse, and depression. And older at this point are more reluctant to go to doctor's appointments because of the pandemic. And so I think we need to help them to be educated to the fact that there are other modalities for getting care. So that includes telehealth with a visit to a psychiatrist, and possibly there may be openings sooner at this time because of the fact that telehealth is now available, and telepsychotherapy. So there are a lot of that are providing psychotherapy through telehealth, and that is covered by most insurances at this time. That's a new development, which we are all just very happy that our seniors can get mental health care, psychotherapy, and access to psychiatrists through telehealth at this point, and Medicare is covering it. So we need to make sure that people are aware of this.
Yeah, absolutely. I think the new telehealth progress that has been made has been such an excellent addition. And if we can get our clients to understand it and be able to utilize it, it will go a long way. Which comes to the question of social distancing a little bit more. You know, we hear that terminology all the time. But how do you think that the virus and the social distancing recommendations impact older adults differently than it might impact younger adults?
Well, social connectedness is required for successful aging. So at this time of social distancing, it's inevitable that successful aging is impacted, and that in particular, if people are more depressed and anxious, that is going to impact their well-being and quality of life and aging. So bereavement an all too common experience for older adults, and many of my clients describe feeling like their circle is smaller as a result of losing friends and family. So we already have that factor that's occurring, and this lack of ability to see people that are still present in our lives is only increasing that feeling of isolation and loneliness. The lack of work for many of our older adults who work or volunteering, those opportunities have been lost in this pandemic, and that can certainly increase the tendency to feel anxious or depressed because of that loss of meaningfulness and engagement in life. And lack of structure. I think for any of us, the lack of structure and lack of routine can certainly be discombobulating and increase feelings of depression and anxiety, because there's positive, meaningful things to focus on, and people may become overly involved with the news and watching the news and to the extreme where they're not engaging in these other activities that can fill their life with purpose and enjoyment. And the loss of ability to participate in hobbies and activities outside of the home is a significant problem for our older adults right now, with activating events, and often we'll prescribe those, we'll suggest those for older adults who are experiencing depression. So without those opportunities, it's difficult to find ways for pleasant distraction or enhancing mood and quality of life.
So what do you suggest that older adults and their friends and families do to either avoid or mitigate serious problems during this period of social distancing that is somewhat unavoidable for a lot of folks?
Anxiety and depression can have a very negative effect on physical health and wellness for seniors. It is associated with higher mortality, and in particular, increased risk for cardiovascular disease, and it also increases the risk for dementia. So it is very important that symptoms are identified early and, as I said, not mistaken for something else, whether it be medical problems, medical conditions related to side effects of medications, or being mistaken for normal aging, or seen as dementia when instead they are mood disorder related. So having an adequate psychiatric evaluation or psychotherapy and neuropsychological testing and consultation could be very helpful to avoid these issues and the possible long-term effects if they are able to be caught early and treated. And even though, as I mentioned, even though we are socially distancing, there are services available. So that can help to address these types of issues.
So what are some things, you started to reference it in your last answer, but what are some things that people can do to maintain the mental health, the good mental health that they have during this and other challenging times?
I think first and foremost, it's so important that people have regular contact with family and friends. And a lot of my clients have commented on how wonderful Zoom and FaceTime and telephone calls have been for this. The fact that in some cases, they are seeing family members that they didn't have as much contact with even prior to the pandemic. So they're seeing those family members more now, and that's one of those silver linings that we can see that is coming from this, that suddenly people are discovering that this method of communicating is there and could continue even after the relaxations to social distancing. And creating a daily routine with structure, as I mentioned, would be important, because the loss of routine and structure can result in feelings of lack of pleasure and lack of meaningful engagement. So finding some ways to build that structure and routine into our daily lives is really important. And that also includes a bedtime routine. So a lot of people have said to me that they feel like their schedule has gotten all out of whack and they're not sleeping well because they've changed their sleep schedule as a result of not having the activities scheduled that they were going to prior to the pandemic. So it's really important, I think, to even think about winding down before bed, having a time that you do that, and getting an adequate amount of sleep, because not sleeping well can affect our mood. And some people find it beneficial to engage in relaxation strategies, definitely making sure that your sleep hygiene is good. So that might mean turn television about an hour to an hour and a half prior to bedtime, and not drinking caffeine later in the day. In fact, caffeine can have a 5 to 7 hour half-life. So really thinking about that, if we are consuming a lot of caffeine or alcohol, which can also affect sleep, trying to make sure that we think about consumption of those things, and reducing consumption if possible. Also, if there's and other substances that are being used, possibly thinking about increased risk for use at this time, and how maintaining control over this is important. Exercising, which can be taking walks, doing activities that I know you're providing through the senior center. I think I've heard of some activities such as chair or other types of activities, and those are also available online through other resources. So I think it's important to make sure that people continue to connect with things that are good for their physical health as well as their mental health and well-being. And finding new hobbies. This is an opportunity. Here's where we see the silver lining part again, that maybe someone hasn't ever been much of a baker or liked cooking, but this is the time to discover some avenues to learn new things to cook, or learn new activities, maybe knitting, or learn a foreign language, or start reading books that you've always had on your list but never really had the opportunity to get to. Maybe even doing some crafts. I know a lot of older adults who like crafts, who say, oh, I know that with the holidays, I often feel the rush to get things done. Sometimes I want to make some crafts for people, but I don't have the time. Well, here's the opportunity. So we need to look for the hidden opportunities, or the silver linings here, I think, that allow us to do things that perhaps we never had the time to do, or we had been delaying and now can do. Avoiding the constant news consumption, as I mentioned, and the negative things, and especially with people with trauma, staying away from things that are going to be upsetting is going to be important. And if treatment is needed, the good news is that 60 to 80% of individuals who get treatment for mental health symptoms do see improvement. So it is important to, as I said, identify these issues and to seek treatment, and know that these symptoms could be improved, and that people could have a better quality of life. So the other thing I want to talk about is something called the relaxation response, which refers to use of meditation, yoga, or relaxation strategies to promote a deep state of relaxation, which reverses the stress response, including our central nervous system and autonomic nervous system activity, arousal. This is associated with a decrease in heart rate, blood pressure, and breathing rate, and metabolic rate, which can be very beneficial in allowing for the recuperation of the harmful effects of stress, which certainly people are going to be experiencing more of at this time. And this can result in feelings of empowerment and more control. And it involves engaging in a repetitive mental activity that entrains the thoughts on one thing, and focusing on perhaps something repetitive. So that might be focusing on counting our breathing. So maybe while we're taking some relaxed breaths, counting 1 on the inhale, 2 on the exhale, or perhaps not necessarily on counting the breathing, but just focusing on the sensation of breathing. And the important part as well is to passively allow thoughts to come and go without judging oneself and without focusing too much attention on the thoughts, but rather just allowing oneself to stay focused and to gently bring their mind back to the focus on the sensations of the breathing or the gentle counting that you might be doing while you're breathing. So this is a little diaphragmatic breathing, which is a relaxation strategy where we are actively focusing on breathing differently. And the goal is to actually drop the breath down to the diaphragm, which if you put your hand on your belly, and everyone can do this who would like to while you're viewing, of course. And if you feel the top of your hand should be touching right below your rib cage, and down the bottom of the hand is down near right around. And you want to focus on taking some nice deep breaths, inhaling through your nose and then exhaling through your mouth. And I will demonstrate how this is done. So we're inhaling through our nose and should feel our abdomen expand like a balloon. And then we're exhaling through our mouth and we should feel our abdomen go in and up. So I'm going to inhale. I hold it briefly, and then I exhale. I hold it briefly, and then I inhale. Hold it briefly, and exhale. Hold it briefly, and inhale. Holding it briefly. Exhale. So if we're able to do that for a couple of minutes, this can cause a reduction in blood pressure and slow down our breathing. We're getting better oxygen, and some people even report feeling a little lightheaded because they don't typically breathe this way. We often breathe from our chest. So that is not something to be worried about if you do feel a little lightheaded. It means you're getting better into your brain. But it's a good thing to do, and it's, as you can see, very easy to practice. And we often recommend people do this once or twice a day, and when you're in a calm state, to begin practicing this type of strategy, and it can help bring your stress levels down. The other thing is just focusing on positive things around us. So going out in the garden if you're able, and just or out on a nice walk if quieter area and it's safe to do so, and focusing on being mindful of nature and noticing things around you can be very beneficial. And a lot of people do tell me they get enjoyment and a lift to their mood from doing these things. And I know that I myself do as well. Savoring is something that we can do at this time, really focusing on things that we might not notice when we are rushing around and busy in our life. So really noticing that cup of coffee in the morning, holding it in your mouth briefly and savoring that taste, or taking a bite of chocolate if you eat chocolate, and holding it in your mouth and really savoring that taste. And so this is a time when we can notice things more, and that's something that relates to mindfulness, as I was mentioning. So all of these things can help with reducing cardiovascular issues, and they've even found in several studies that yoga, mindfulness, relaxation strategies can be associated with preventing dementia as well. And I think the thing that's really important to consider is our characteristics and how we cope. And there are some characteristics that are linked to more resiliency at times of stress. So those include optimism, flexibility, faith, finding meaning in struggle. So obviously it's tough to know why something like this could be happening. But when I say finding meaning in these situations, it's more the finding the silver linings, the thoughts about how can I see the positive in this in some way, whatever positives there are. How can I be connected with people in the way that I want to be? and having moments of gratitude. So being thankful for the things that we do have, relationships that we do have, and the opportunities to enjoy some things that we have been missing previously in our lives. And the thing that's so important, and I like to leave off here, is the wisdom that our older adults have and the accumulated experience of coping with difficult things throughout life. That in itself is something that I think is a unique characteristic that older adults have. And trying to remember how you've coped with difficult times in the past, access those coping strategies and the wisdom that older adults have in getting through those challenges, other challenges, can be so helpful to many of us as well, others who are trying to cope with this pandemic.
So, as with so many issues that we face in life, it's really important to be informed and to know where you can reach out for help. I'm so appreciative of Dr. Movitz's insights into this issue, and I hope that this interview will help folks to be successful in navigating this challenging time. You know, anyone can feel free to call me here at the Senior Center at 978-692-5523 if you feel like you're struggling with any of these things, or you just want to talk at a time that is quite unprecedented. We're here for you, and I can help you to brainstorm and strategize and even refer you for additional help if that's what is needed. And we thank you so much for listening today. And thanks so much to Dr. Movitz.
Thank you, Alison.